Good evening, I'm Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have a doctor from Stony Brook Children's Hospital to help you sort through what's going on with COVID-19 in our communities and across the region. Of course, this is a call-in show. You know, you've seen this show. You want to hear from you. Call us at the number right there at the bottom of your screen, 516-393-1800. Well, today, Governor Cuomo says some regions of New York are closer to reopening than others. Long Island right now has only met 2 of those 7 CDC guidelines. That's for testing, as well as seeing a 14-day drop in hospitalizations. Now, the governor says currently no region meets all of the requirements that are necessary to reopen safely and securely. Now, the coronavirus continues to decline statewide. There are nearly 319,000. Keep that in mind. 319,000 confirmed cases since the pandemic began. That was just in March. Nassau Executive Laura Curran says the county hit a milestone with diagnostic testing. She says only 12% of those tested yesterday came up positive. That is the lowest percentage so far. Now, island-wide, COVID-19 has infected more than 72,000 people, again, since March. The governor says the death toll not declining anywhere near as fast as he'd like to see it decline. The virus has claimed the lives of more than 19,400 New Yorkers. Nassau officials say hospitalizations are down for the 19th straight day. However, Suffolk Executive Steve Malone says hospitalizations slightly increased. More than 3,000 people have died in Nassau and Suffolk counties. Just terrible numbers. All right, let's get to the conversation. Joining us tonight is a friend of the show. I think we can say that by now. Dr. Sharon Nachman, the Chief of Pediatric Infectious Diseases at Stony Brook Children's Hospital. Again, as always, you heroes take your time and you spend all day helping out, and then you come here and do another public service. So we appreciate that. Thank you so much. You hear the numbers. Do you see, with what you're seeing at the hospital, do you see that light at the end of the tunnel?
So we're definitely seeing the light at the end of the tunnel, and I'm hoping it's not a truck coming in our direction. So we are seeing much fewer cases of COVID, both on the adult side as well as the pediatric side, in the emergency room as well as in the ICUs. That doesn't mean we're down to nothing. More importantly, people are continuing to isolate. As the governor pointed out, we're meeting some of the criteria, and that means soon, I hope, we'll meet more of the criteria and we'll open up. The problem will be everyone opening up at once and rushing out to see their friends and neighbors and their kids and grandkids who they haven't. That concerns me because I'm worried we may see a small but real spike again.
Yeah. I was going to say, I see I get the frustration. I'm frustrated as well, being cooped up inside and then here. But I'm seeing pictures of people coming out and not social distancing, not using the mask. Is that what's going to throw us back into another relapse?
It probably will. And I think seeing your neighbors, but using that social distancing and wearing the mask and continuing to do that for the next few weeks or as long as the governor tells us to do is going to be absolutely important. Okay,
and I know that you and I talked before the show, and we have another thing to worry about because it's May, and as we know, it's warm, and May is Lyme disease month. So that's something else we have to worry about, right?
We are already seeing children coming into our emergency room with brand new Lyme disease or with ticks on them because the weather's been so nice, everyone's been outside. And when you're outside where the grass is tall and the leaves are coming down on the trees, that's where the ticks are. And by brushing against them, yes, you might find a tick. Take them off right away because that's the most important way to prevent Lyme disease.
Yeah, everyone wants to go outside, but now we have to be careful about that as well. All right, let's go to the phone. I think we have Kathy from West Islip. Kathy, you there?
Hi.
Hi.
Yes, I am. Hi. Thank you so much for taking my question, and thank you, Doctor, for all that you and our healthcare workers have been doing. My question is, of course, regarding our grandchildren, especially my youngest at 7 months old. Now, we have all been home and isolated, and they have been home and isolated, and their parents have been working from home, and we have been home as well, us as the grandparents. So is there any way that it is safe for us to visit with them in their house, at our house? Can I help care for the baby while?
Okay. Doctor?
So I think the first thing to start with is continuing with the isolation or the distancing, but try a picnic. Try the backyard or the front yard, or just walking past while they're pushing the stroller. Stuff like that will definitely be a nice first way to get back into their lives. Hopefully over the next few weeks, as the numbers continue to dwindle and the risk in our environment of seeing someone who has COVID continues to drop, you will be able to perhaps take off the masks and hang out and play with your grandchildren and come in close contact without having to observe that 6 feet distance. Are we there yet? Not right now. Are we going to get there soon? I hope so.
All right, let's go to Anthony at Kings Park. Anthony?
Yes, good evening. I had a quick question for you, Doctor. In reference to this virus,
Okay.
the other day I was watching News 12 and they showed a protest and they had these young people out in Comac and they weren't wearing any masks and their parents were with them and they weren't wearing any masks. Couldn't their immune system be compromised also?
The younger kids. That's a great question. Younger versus older individuals.
So certainly we have seen a lot less infection with the younger kids and the young adults compared to older adults or elderly populations. Having said that, do I think we should have protests where young and old are all mixing together without wearing masks? Probably not such a good idea right now. I think we still have too many new infections in Nassau and Suffolk to allow that mingling across ages and certainly mingling together with people that you don't know how well they've been isolated. So right now, I think those protests may bring us a little bit of a blip in the next 2 weeks. But as I said, and with the governor's guidelines, I think we are in for allowing us to get away with that, social isolation. It's still going to take us another few weeks to get there.
All right, let's try to squeeze in Tommy from Elmont. Tommy, you there?
Hey, how you doing there, Stone?
I'm doing great. What's your question?
Okay, here's the question. Are you more likely to catch the virus from someone with severe symptoms as opposed to someone with mild symptoms?
So people are studying that question right now, and they're trying to figure out if someone who's quite sick has a higher viral load, and when they pass the virus to someone else, gives them a higher boost of virus and they get sicker. Unfortunately, the science hasn't caught up with the theoretical questions. I'm hopeful, though, in the next few weeks to months, as we have animal models that we can infect and see how infectious they are to other animals, we'll start to get an answer to those very important questions.
Okay, let's try to get Don from Bethpage. Don, you there?
Yes.
What's your question tonight?
I'd like to ask Dr. Sharon, what is the high and the low temperature that will kill the virus?
So it's not so much of a temperature question that kills the virus. It's more of how well it can stay hydrated. This virus does not have a lipid layer around it, which means that it's subject to dehydration. So if it's warm outside, it'll perhaps dehydrate. If it's cold, it'll dehydrate. Certainly body temperature is a wonderful temperature for it, and it won't dehydrate in that temperature. It's not the sun that kills it or the cold air that kills it. It kills itself because it can't protect itself from dehydration.
Interesting. Ann Beth from West Islip. Ann Beth, you there?
Yes, hi. How are you?
I'm great. What's your question tonight?
Is it Dr. On?
Yes, she is.
Oh, okay. My question was, I know that the virus causes like a cough and a fever and different illnesses, but I was wondering about the neurological effects and the blood clots and stuff like that. And is it the same in adults as in children? And is that something new that they're finding out, or?
Okay. Well, I know it's new, but.
So the first and the easy answer is children certainly can get the same presentations that adults do, but because children are more often asymptomatic, we actually don't see them. With regard to the blood clots, they are seeing it occasionally in children, much more often than adults. We watch for it in both populations, particularly among those that are hospitalized or in our intensive care units. With regard to the neurologic complications, I think it's a little soon to give you a definitive answer because we haven't had enough time to actually long-term look at all those patients who in fact had proven disease. Ask again in another few months and perhaps we'll have a better answer.
Yeah. All right. We're going to take a real quick break, and when we come back, we're going to have more expert advice on how to keep you and your family safe from the coronavirus. And remember, we do want to hear from you. Call us now with your questions right there at the bottom of your screen, 516-393-1800. If it's busy, just keep calling. You'll get through eventually. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in Dr. Sharon Nachman, the Chief of Pediatric Infectious Diseases at Stony Brook Children's Hospital, and giving us generously her time after very long days. Doctor, let me ask you this. I get this a lot on social media where you have family members who are all isolating together. One member gets infected, the other member of the family goes in and out of work. Should that member contact his or her work and let them know that he has a family member that has been infected? And should this person who is infected be well before this person, the other family member, goes back to work?
So it's a complicated question because we don't know enough about that second family member. Who gave it to who had it first? Because it is just as possible that the person who's well, who's going back and forth to work, in fact brought it home. They were an asymptomatic carrier and we didn't know that, and they got their close household family member in fact sick. I do think it is important to tell their work that their brother, sister, mother is sick and they're living with them, and let work decide what do they want to do. More often than not, work is going to say, you're on isolation for 2 weeks until we see if you have symptoms. And if you have no symptoms, come back to work. Certainly, they're not going to want him at work without wearing a mask. But again, because so many people are asymptomatic carriers, we don't know who came first, the person who's now sick or the person who's going to work.
Okay. I hope people on social media all heard that. Let's go back to the phones. Susan, are you there?
Yes, I am.
Susan, what's your question tonight?
My question is right on point with what we're talking about. How long is an asymptomatic person a carrier?
So, based on what we know about the virus now, we are assuming that they are going to be able to pass infection for about a week. It may be that some of them perhaps pass it a lot shorter or a little bit longer. But certainly after 2 weeks that you're well, we do not think that you're passing virus to anyone anymore. You have to appreciate that the testing that we're doing, which is a PCR test, they put a swab up your nose and to look for virus, does not in fact look for live virus. It only looks for part of the virus. And it's hard to say if the part of the virus that they found represents live replicating virus that you can pass to someone, or dead virus that's just been sitting around in the hairs in your nose and not going anywhere at all. Because we don't know that, people assume that if you're positive on the PCR test, you're infectious, but certainly after 2 weeks, you're probably no longer infectious.
Okay. How about Marie? Marie, you there?
Yes, I'm here.
What's your question tonight?
Okay, thank you very much for your service, doctor. And what I want to know is, I live in a development, and the ladies like to get together with masks and distancing. And what we want to know is it safe to use those chairs that are scattered all around? They're made out of metal.
So I think those chairs are perfectly reasonable for you to use because it's really hard for the virus to stay alive on the chairs. If you're very concerned, I would actually just wipe down the areas or the armrests where your hands are. Certainly where you're sitting should not be an issue. But if your armrests are touching the armrest and touching your face, that's the part I would worry about. Otherwise, it's probably not a concern.
Okay. How about Tio? Are you there?
Yes, I am here.
Okay. What's your question tonight?
My question is, for the schools, will the desks be separated because of social distancing, and will there be less kids in the class?
So right now the schools are trying to wrestle with what to do in the fall. I've heard every school district has a SWAT team trying to figure out, is it better to have a few kids come for 1 week and then swap off week to week, social distance the whole class, have half the class distance learning and half the class in learning. I think the key to answering all of this is going to be how the summer is, how much virus we're seeing in people in Nassau or Suffolk County, how much we're seeing coming into the hospital, because those numbers will tell us how much virus is circulating in our community. And if the virus numbers are low, there's much less risk for transmission, and in fact, the numbers can then increase as to who's in the classroom. But until we know those numbers, it's really right now just a plan.
And doctor, let me ask you this, as after summer, when we get through summer, it's going to be flu season again. Should we be thinking about getting the vaccination? Should we be a little weary of it? What's your opinion on that?
So I think anything that we can prevent that's going to have the exact same symptoms that COVID has, we should really think about preventing. The flu vaccine is a great idea for all ages, young children through elderly, those people that pass virus, like the kids, or get incredibly sick, like the elderly. Everyone should get their flu vaccine, because we want to be able to take something off the table and say, the symptoms you have, you got the vaccine, it's probably not that. Or worst case scenario, you didn't get the vaccine and you have both illnesses, one on top of the other.
Okay, I don't know if we have time for Roberta, but let's try to get her in. Roberto?
Yes, hi, how are you?
I'm doing great. What's your question?
Quick question. I was wondering, does coronavirus have any affiliation with a decreased amount of potassium levels in a patient?
Okay, we got about 30 seconds left, doctor.
So the answer is not really. Patients who have abnormal potassiums often have renal disease or kidney disease. So if someone is presenting with abnormal levels, low or high, I think it's worth a visit to their doctor to see if there's any kidney issue underlying it.
Okay, that was great. Unfortunately, we're out of time. Once again, thank you so much for everything you're doing, Dr. Nachman. You're a great friend of the show and a great friend to Long Island, and for everyone that is doing that. So thank you so much, and tell all your colleagues that every day we thank them and we're thinking about them. And thank you for calling in and for watching the show. We'll see you right here tomorrow night at 7 o'clock. Stay safe. I'm Stone Grissom.